I was asked by some people to discuss Opdualag, which is the combination of nivolumab and relatlimab in the treatment of melanoma. So all these drugs, immunotherapy drugs, they really work on receptors on the T cell or immune cell. As you can see here, the T cell or the CD8 T cell, or which is your immune cell, it has a receptor. And I can, when I talk about these receptors, I tell the people I see that they act like brakes on the immune system. That cancer takes advantage of these receptors, which act like brakes on the immune cell in order to escape the immune attack. One of these receptors is called the LAG3, and as you can see it here, the LAG3 is expressed on the T cell. So what relatlimab does is basically it removes the brake, or it inhibits the LAG3 receptors, leading to reactivation of the immune cell and hopefully having responses against melanoma. Also, the nivolumab, we talked about it in the past. It acts on a PD-1 receptor, as you can see here, the PD-1 receptor on the T cell. So the combination of relatlimab and nivolumab has been studied in a large clinical trial. It's called the Relativity 047 clinical trial. And in 2023, the 2-year survival data, overall survival and progression-free survival, were published in the New England Journal of Medicine. As you can see here in the figure, the 2-year progression-free survival was 38.5% for the combination of relatlimab and nivolumab, or the drug we call Opdualag, compared to 29% for nivolumab. Combination of relatlimab and nivolumab is an effective treatment and resulted in an improved progression-free survival, which was statistically significant amongst patients with advanced melanoma. However, if we look at the overall survival, there was a trend to benefit in the combination of nivolumab and relatlimab, not reach or did not meet its statistical significance. So we can say, based on this clinical trial, that the combination of nivolumab and relatlimab resulted in an improved and statistically improvement in progression-free survival amongst patients with advanced melanoma who received this treatment as the first line. Grade 3 and 4 toxicity, these are severe side effects, happen in approximately 20% in the combination compared to 11% amongst patients who received only nivolumab. The results showed that the objective response rate, these are the people who achieved partial response of the tumor, is a tumor shrunk, or a complete response of the tumor, that was achieved in 43.1% among people who took Opdualag versus 32.6% among people who took nivolumab. How about people who received ipilimumab and nivolumab instead of Opdualag? They received it upfront for stage 4 melanoma, and let's say they didn't respond. Can we give them Opdualag? Yes, we can. And there is a clinical trial that looked into answering that question. It's called the Relativity 020 clinical trial. While they looked at the benefit of giving Opdualag, again, the combination of nivolumab and relatlimab, after failing immunotherapy in the past. And so they had, these people, more than 50% of them, they have received immunotherapy in the past, whether it was Opdivo, Keytruda, or the combination of Opdivo and Yervoy, and even they have received targeted therapy. Well, the objective response rate, meaning partial response, either shrinking of the tumor, or complete response, complete disappearance of the tumor on imaging, was achieved in 9 to 12%. So again, when we move from Yervoy and Opdivo, if the patient received Yervoy and Opdivo in the past and they are not responding, this is the number. The chance of response, or the objective response rate, is anywhere between 9% to 12%. And these responses, when they happen, they tend to be also durable. So to simply answer that question, yes, there is a benefit. Still, there is a benefit. Yet it is a small benefit, 9 to 12% of achieving a response to Opdualag, even if the patient failed prior immunotherapy drugs or even targeted therapy.